1 month of health insurance. New York, $1,090. Dubai, $681. Tokyo, $13. Same coverage promise. 3 entirely different countries confessing. But that number is a lie. Richer country, higher premium. That is the assumption every traveler carries. Dubai is wealthier than Tokyo. The premium says otherwise. The assumption just broke. $13. Read that again. $13 buys in Tokyo what costs $1,090 in Manhattan. The sticker is not the real price. 3 countries just confessed 3 different things. 3 confessions are loading. Start with the loudest one. New York. Manhattan. Maria, a 42-year-old freelance designer, opens her pay stub. $1,090 vanished before she clocked in. Her ACA Marketplace Premium, Silver Tier. She has not coughed. She has not called a clinic. The premium fires first. The doctor comes later, if ever. Before insurance pays a single cent, she owes $5,900. That is the deductible. A wall. She climbs it alone every January. Only then does coverage begin. And this is not even the real price. Add her husband and 2 kids. The family's annual tribute to the system, $22,000. For nothing they have used. For everything they might. Now, picture a scenario. Maria slips on a Flatbush sidewalk. Breaks an ankle. The meter does not stop at $22,000. It keeps climbing. Another $9,000 before the out-of-pocket ceiling closes the wound. $31,000 for one bad step on ice. In the American system, roughly a quarter of every healthcare dollar. Never touches a doctor, never touches a nurse, never touches a pill. The receipt beneath the receipt. Where does that quarter go? Billing departments, claim denials, prior authorizations, competing networks, competing forms, competing profits. An entire industry decides whether you can use the insurance you already paid for. But the next city closed that labyrinth by law. Tokyo did not build this labyrinth. No competing networks. No denial departments. No quarter skimmed off the top. The next receipt reads $13. Same month. Same promise. But the $13 receipt from Tokyo isn't just cheaper. It reveals the number that truly breaks the American system. $13. That is the monthly premium for a new resident in one of the most expensive cities on earth. Not a discount, not a trial, not a government subsidy buried in fine print. The actual receipt. The system is called National Health Insurance, and it is looking backwards. Here is the trick. Japan prices this year's premium using last year's income. A freelancer who earned nothing last year pays almost nothing this year. A newcomer who just landed has no Japanese income on file at all. The ledger is empty, so the premium follows the ledger. Aiko, 26, arrived from Osaka in April. Her prior year income registered in Tokyo as 0. Her premium came back $13. Same clinic, same specialists, same MRI that cost thousands in Manhattan. The receipt explains it. Administrative cost in Tokyo's system is about 4%. In New York's private market, it is closer to 25%. 1 in 4 Manhattan dollars pays the paperwork, the billing departments, the denials. Tokyo collapses that entire industry into a single line item. When Aiko does see a doctor, the rule is flat. 30% copay, no deductible wall, no $6,000 threshold before coverage begins. No envelope arriving 3 weeks later with a number she cannot translate. The price at the counter is the price. The mailbox stays quiet. Per year of coverage, New York charges nearly 100 times what Tokyo asks a newcomer. Same service, different math. But $13 is not the real price of ICO's coverage. Roughly 30% of the true cost is absorbed by government and employer subsidies, buried inside the national budget. The citizen never sees that line. The price is honest at the window. The price is also incomplete. A lead waiting on the desk. Dubai. The same monthly premium reads two very different numbers on the same street. The receipt is about to reveal what zip code really pays for. Dubai. Sheikh Zayed Road. On one side, a construction worker pays $16 a month for basic coverage. On the other, an expat banker pays over $2,000. Same skyline, same hospitals, two completely different entry prices. The gap is engineered. The essential benefits plan sits at the floor, legally capped for low-wage workers. Above it, the luxury tier floats free. $681 is the middle. The ceiling is whatever an expat will sign for. One premium is capped by law, the other is capped by appetite. Health is not a service here. Health is real estate. You rent the address. You rent the view. The premium is the lease on your future emergency room. Rex pins the address to the board, a hospital priced like a penthouse. Emergency room listed like a view suite. Two workers enter the same door carrying different leases. 3 workers, 3 bills. The Manhattan designer surrenders $1,090 before she clocks in, then climbs a $5,900 deductible. ICO in Tokyo pays $13. The Dubai banker pays $681 and calls it a bargain because his neighbor pays triple. 3 completely different relationships to the same human body. America hides the cost inside the deductible, a wall behind the premium. Japan hides the cost inside the budget, a ghost paid by last year. Dubai hides the cost inside the brand, a logo charging rent. 3 philosophies, 3 hiding places, 1 human body. The premium is never the price of health. The premium is the price of a philosophy. Pick your country. You have already picked your philosophy. The receipt is just the proof. Filing the report. New York sells sickness as a subscription. Pay monthly or forfeit access. Tokyo asks for the number before the market does. $13 because the country said so. Dubai writes a different receipt for every gate you enter. The gate you enter decides the receipt you carry. The premium is a diagnosis. It reveals not the cost of your treatment, but the sickness of the system that wrote the bill. Every premium diagnoses its system, not its patient. One case closes. Another receipt waits on the desk. Another city. Another price that does not add up. The investigation continues. Case closed.